Hi, I'm the educational consultant with Advanced Nurses at ACD for N, and today I really wanted to talk to nurses who are interested in transitioning to HIM or the HEDIS roles. So I've been hearing a lot of nurses, especially the nurses that I meet with, whether I'm meeting with them on one-on-one sessions or I'm meeting with them in group sessions. I've been hearing a lot of chatter about their interest in working in HEDIS and even nurses who are interested in CDI. Now, HEDIS has always been one of those places, opportunities rather, where when nurses want to transition to HEDIS, I feel like there's like a need to like demystify it. My first HEDIS opportunity, it really came about when I changed my resume. So I will say that the what we're going to be discussing today is really about changing your resume. And that was where things really changed for me. I think it's also important for nurses to understand their brand. And that's the reason why I'm encouraging nurses. Please consider our Nurse Naomi app. The Nurse Naomi profile actually is the app itself. Essentially, it's really just an opportunity for nurses to summarize their brand, their experience, their background, what they do, what they want to do, and if there's any projects that you've been working on. So it really helps to make sense of a lot of the things that you've been working on and where your passions lie. And then also, if you are networking, this is where you really get the benefit of the Nurse Naomi app. The VS tag, to be specific, is that when you're networking, you scan that QR code for the VS tag and it connects you to the website and also automatically shares your contact with the phone. So it literally drops your contact into the phone after the VS tag is scanned. So again, it's a QR code scan. The contact is downloaded automatically to the phone of the person you're networking with, and so it's a really tech savvy way of transitioning away from your current roles and connecting with people and new opportunities and sharing information, sharing your contact with individuals who you meet at, let's say, conference or networking events. So I just want to talk about some key aspects of your resume that nurses really need to think about. So first, I just did a plug, okay, shameless plug of our Nurse Naomi VS Tag app. But I also want to highlight with that. So that's that branding piece, your resume. So after branding, your resume is the other thing you need to really focus on. In each resume, every resume should have a summary. Your summary is essentially saying this is how many years I've been in the nursing field, whether I'm an LPN or RN, and this is where I am going, and this is what I'm interested in, and also these are the skills that I have acquired that I believe are transferable. Simply put, so how many years you've been in your area of nursing, what is it, what you're interested in transitioning, what skills transitioning to, what skills have you acquired in your previous nursing experience that are transferable, that will be transferable to the new role. Those are the four components. So how many years you've been a nurse, what skills you acquired, where you want to go to, and how those skills will be able to be transferable to the new role. If you can complete that in your summary, those four key aspects, you should be fine. Your summary should not read as if you're selling yourself, but more so declaring what your brand is. I see a lot of people, when I say selling themselves, they have so much going on in their summary. It's like, are you trying to apply for the CEO role? We have to also be honest about what we're applying for. Don't put more in your resume than you have to. You may have a wealth of knowledge and you may be coming from a really dynamic background. Listen, I'm just going to give you a red flag warning. If you have too much going on in your summary, it could open you to a lot of exploitation. You have to be very careful with that as nurses. A lot of times we're working in places that will ask us to do a lot more than what we initially signed up for, and we may really want to put all of that on a resume, and then you find yourself in a new role being kind of dumped on, so to speak, and a lot of it could be coming from the fact that your resume is probably too dynamic. So just keep it And I know that's not really common. Most people tell you to make your resume very dynamic, but you never want to just come across as like a jack of all trades unless you are applying for a role that is requiring someone with really strong leadership skills because of this their vast, more expansive knowledge in healthcare. So just try to keep your resume very concise and specific. If it's specific to CDI, specific to HEDIS role opportunities, you want to keep your summary very specific to that and keep your resume very specific to that. So here, the mention of the years, again, as I expressed before. So let's look at some of the skills that we would leverage. Patient assessment. It's very important for you to understand disease process and the type of care that routinely goes with certain conditions. This is true for HEDIS. This is true for CDI. Medical record analysis. You have to be comfortable doing medical record reviews. With HEDIS projects, 100% of the time, you are going to be trained in the software that organization is using for HEDIS. I say this to say, this is a key thing. I want nurses to write this down and think about this. The HEDIS measures is what you have to know. I will attach a summary of HEDIS from an official link to the description of this video. The HEDIS measures is what you need to understand. HEDIS measures are not as complicated as they sound. HEDIS measures are, and I'm going to attach the breakdown of it. The HEDIS measures are really looking at the activities or the evidence that an activity occurred that would be like measurable for quality purposes, right? So I say that to say there are things that you do as a nurse, for instance, collecting a blood pressure on a patient who is hypertensive, or collecting A1C on a patient who's diabetic, who has a diagnosis of diabetes. That moves HEDIS along. That's kind of what HEDIS is focused on. And an analyst role, you always want to make sure that you are comfortable with reviewing large amounts of data to come up with insights, recommendations often for either provider education or for process improvement. And then also regulatory compliance. It's important for you to understand the regs around NCQA because that's who the National Committee for Quality Assurance, that's where HEDIS comes out of. HEDIS is Healthcare Effectiveness Data Information Set. So those measures for the HEDIS measures, they come out in NCQA. And so it's important for you to understand that. When it comes on to CDI roles, regulatory compliance is really in alignment with CMS, right? And then, of course, whatever organization you work for, they may have their own concepts around what compliance looks like. That's like added on to CMS's expectations. And then your data-driven care coming out of HEDIS and CDI is really about you being comfortable reviewing those records and looking at best practices. So understanding best practices is really important. I encourage nurses to align themselves with either mentors or friends who are coders, and also mentors and friends who are providers. It's important for you to learn from both coders and providers if you want to be successful in this space. Proven ability to accurately abstract complex clinical data, ensure adherence to quality standards, and collaborate effectively within interdisciplinary teams. So it's really important for you to know how to work across different disciplines and work across different levels of expertise. And then again, you also want to be aware of, depending if it's CDI or depending on if it's HEDIS, you want to know what data you really need to be abstracting, right? Again, HEDIS abstraction, the data for HEDIS abstraction may live in a totally different paradigm than the data that you're pulling for CDI. So again, depending on the purpose of your record review will drive the kind of clinical data that you will be abstracting. Data abstraction. I'm glad we went there first. I remember when I was first interested in HEDIS, I did not understand what data abstraction was. I thought data abstraction was this big old fancy convoluted process where you were using big clunky machines and these really complex EHR systems. Data abstraction can happen on a spreadsheet. Data abstraction can happen with an abstraction tool. Data abstraction can happen in so many different ways. It's hard for you. There's no way that you can say data abstraction is kind of a one size fit all. Data abstraction really is you being able to pull that information from the source and then use it for whether you're collecting for research or whether you're collecting it for analysis, whether you're collecting it just to for like quality reviews. So data abstraction really is being able to review this information, but you're also interpreting the information you need for the purposes of that review. So again, you're reviewing the record, you're taking out data that is in alignment or satisfy the purpose of your review. Quality and compliance. So understanding of healthcare quality metrics. So understanding HEDIS, understanding STARS, understanding as NCQA standards, understanding HIPAA. All of these are really important concepts that drive the work that each of these organizations do. So it's important for you to understand what those quality metrics look like. Also, being analytical and detail oriented. This is somewhere I think that a lot of nurses naturally have, but I feel like a lot of nurses miss the mark in the sense where a lot of nurses don't realize like how analytical or detail oriented we are because of the fact that a lot of what we learn foundationally as nurses is really based on something that you did. So, for example, you took this action and now you're sitting back to analyze what happened. So, you gave the patient the pain medication. Now you're looking to see if the pain medication works. Okay, now we're going to also look to see the next step would be to look to see if this medication works better at night. Do you find that if you give this certain medication to the patient in the middle of the day, that the patient is up all night? So that's the analytical part. But again, a lot of times in nursing, our analysis is based off of actions we've taken. So when you're talking about like HEDIS and you're talking about like CDI, we're really talking about doing analysis on work that services someone else rendered. And that's really important because there are a lot of concepts around kind of how should I say, like, for example, from a physician's perspective, a physician, for example, who is a CDI physician, because there are some physicians that work at CDI, they should not be doing CDI work on the rec or the services that they have rendered, right? So that's a little caveat I wanted to add. But in most cases, nurses who are doing record reviews for HEDIS or doing it for CDI, if depending on which role that you're applying for, which role you're interested in, those nurses essentially they're going to be looking at records of some services that were rendered from someone else, a different provider. So the provider types in most cases will be your, let's say, a PA, a nurse practitioner, physician, or a physician, right? So those are those are really the three main types. And again, those are approved physician types, so provider types for rendering services. So you always want to make sure that you're also looking at credentials. And so again, these are just things you want to think about. Have you been in your current role reviewing services rendered by different provider types? Are you using this information to help you with care planning? And so those kind of things, you really want to call that out in your resume, that you're reviewing the record to coordinate care. You're reviewing the record to address quality gaps. You're reviewing the record to um, coordinate patients with their specialists, right? Connect them with their specialists. So, or with their primary care providers following hospital stay or following a procedure. All of these are indications that you understand the importance of reconnecting that patient, but you're also doing a look back to see where that patient is on the disease management continuum and ensuring that they're being, reconnected with the right types of services. Also, technical proficiency. If you are comfortable with Epic, Cerner, Meditech, any one of those that kind of software, if you're comfortable with Google Analytics, or Microsoft Excel spreadsheets um, and Outlook, these are all indicators that you are comfortable using software that helps with planning, helps with organizing, and more importantly, reporting data and data entry. So we know basic data entry in many cases is as simple as um, an Excel spreadsheet or Google Analytics spreadsheet. So being comfortable with data entry is really important, but also being important is equally important to be able to tell stories with your data. So, for example, spreadsheets, pivot tables, all of these are things that you want to acquire to show that technical proficiency. And that is something you actually can learn on YouTube. YouTube University, you can learn a lot about the dynamic nature and work that can be done in a spreadsheet just by watching YouTube. So that could be Google Analytics spreadsheets, and they could also be using a Microsoft Excel spreadsheet. And I'm sure there's so many other different software systems that provide spreadsheets that where you can test formulas, and you can find ways to clean and manage data in a way that helps you to make um, reports on gap closure and report on opportunities, whether it's within HEDIS or CDI. And then, of course, your clinical knowledge. You see, one of the things that nurses have, and we have that above IT folks who work in healthcare, we have that above coders who work in healthcare, is our clinical knowledge, right? So we have a strong foundation of disease processes, common conditions such as diabetes, CVD, cancer, even the cancer screenings, right? When it's appropriate for a cancer screening, who should get cancer screenings, what indicators do we look for to help with patient education around cancer screenings and other screenings as well, and immunizations, right? So any kind of preventative care that we can promote, we have that knowledge, right? Because we make those connections. And that helps with both CDI or HEDIS roles. And I just want to stress again, I did mention that I was going to include guidelines, the ICD-10 guidelines, to this video. And just want to FYI for those who may not know, ICD-10, we will be transitioning to ICD-11 sometime. United States is actually behind the curve oftentimes with the version of ICD-10 of ICD codes that are used. So we're still using ICD-10, but again, the most important thing is for you to understand whether it's ICD-10, ICD-11, you have to understand the guidelines. And again, I'll include the guidelines in the description of the video. CPT codes are procedure codes. So these are procedure terminology or codes that are, these CPT codes are used to describe procedures that happen. And in the outpatient setting, primarily ambulatory care. I'm not going to get too deep into that because, again, for the purposes of CDI, especially the work that I do, you're mostly looking at ICD 10 codes or ICD codes. But with CPT, you can see some of that in HEDIS, because with HEDIS, you will specifically have to have those CPT codes spelled out. In HEDIS, you can't just use the code if it's just numbers. Just like how in, let's for example, in risk adjustment, you can't just use labs to code. Like, so if a provider did not explicitly write out a diagnosis, a coder would not be directed to code because of, let's say, the EGFR. So the EGFR could indicate that the patient has stage 2 CKD. But if the stage 2 CKD diagnosis is not explicitly written out by the provider, just knowing the EGFR will not be what the coder is going to use to code. The coder can only code what the doctor explicitly writes. So that's where it's similar with CPT, because with CPT code, let's say for like the GSD that's measured with HEDIS, we can't just simply say that just because a person has the code at the end of their encounter, that we can say, oh well, I looked up that code and that code is for the A1C. No, it has to explicitly say that this was like the collection of the A1C. Like it has to explicitly say that that's what the CPT code is defined. I think it's 86. It's like it's an 8 code. I don't remember exactly the exact code number, but it's a 5 or 6 digit code for two, at least now I know they're using for HEDIS, but those are again defined by NCQA, not any organization, but NCQA. They determine what they will accept for HEDIS, which is the reason why I'm telling you that if you're interested in a HEDIS role, you just need to have your resume say that you are competent in reviewing records and comfortable reviewing records, because the organization is going to tell you exactly how they want you to approach their HEDIS reviews. Communication and collaboration, effective written and verbal communication with providers, clinical staff, administrative teams, experience documenting, finding clearly. Two things I would say. One thing about communication is that nurses naturally, we have that connection with communicating with our team members. Even nurses who I would kind of consider more introverted, they have that experience with communicating with their team, communicating with providers. My advice would be for you to demonstrate that you are not only comfortable with writing out like care plans, uh, you have strong written communication as far as your collaboration and again care planning, but also that you're comfortable with presenting patients. Your presentation of a patient does not have to be a conference room full of 200 people. Your presentation of a patient can be you just presenting one patient case. Most nurses work in a capacity where they're presenting at least one or two. I mean, even when you think about your shift change report, that's you presenting on the patient. So if 5 providers come into that room and hear you presenting on the patient, and then based on your presentation of the patient, there's, they get their wheels turning. Okay, so we're going to have this XYZ plan for the patient. This is a part of your communication. So never miss the opportunity in your resumes to express that you are comfortable with with presenting patients, even if you may feel like, oh my God, I'm probably going to buckle if I have to do this in front of 15,000 people. Always think about, at the end of the day, that these are human beings that we're talking about. These are patients, these are real people. You're not talking about numbers. You're talking about patients that you're advocating for. And in some cases, you're advocating also for what the provider may or may not have captured clearly in their documentation, but services that this type of patient either did receive or should have received. And then also problem solving. Nurses are natural problem solvers. So this should actually be in your resume. Any solutions that you have come up with, I would say this is a great opportunity to quantify. I think nurses actually should quantify every task or everything that they've ever done in their work history that they're displaying on their resume should be quantified. And I say that because I find that ATS, the systems that they're using to review your resume, in many cases, can read those numbers and that quantifiable data differently than when you're just writing out text. In many cases, the text is looking for like these buzzwords. I feel like there's something about numbers that I feel like has a different it has a different impact in those systems that they're using now to review resumes. I mean, gone are the days that you have your well written resume looked at by someone first. You know, there was a time that your resume was being reviewed by a human first. I think in many cases, resumes are going through a lot of processes before a human actually touches it. Maybe those processes could be very humanoid or very human-like, but by the time a human gets to it, it has been processed through systems many times over for them to filter out what applicants have more what they're looking for. I find that when you quantify your skills, you're showing impact more than when you just have it written out. Saying things like you've taken care of a lot of patients or patients with XYZ types of medical conditions can be a bit vague, can get lost in the crowd. But if you're saying that you've taken care of 100 patients or 75 patients, or you have a daily output of, let's say, 10 reviews per day or 5 chart reviews per day, it's at least demonstrating that you understand the impact. And now let's look at some roles that we probably want to include. I think it's also important to look at job title. Job titles can be very tricky. You may interview and be hired for a job title that's very different than what your company actually calls that role. A lot of times, if you ever use systems like Workday, for example, you will see that where you could be hired for one title, but if you look in Workday, they have the title under a different name. I wouldn't say to be worried about that, but in some cases, you may want to decide which one of those job titles would be more helpful for your brand, or which position that you're applying for in a future role. So for example, if you are looking for a role that is a little bit more in the reviewer side, and a part of your role is titled as reviewer, it may be beneficial for you to use that. If it's more analyst, then that may be more beneficial for you. If there's a part of your role that is like outpatient or home based, you want to kind of keep those titles inside of your work experience job titles, so that those title names kind of point more towards the work that you were doing. So clinical data review and documentation. So if there's any work that you've done where you're routinely analyzing medical records, you always want to capture that. Any kind of documentation of care, if whether you're doing it for billing purposes or reporting purposes, it's important that you have that. I think when you use the for, always think about anything you're doing. When you use for, whatever follows behind that is showing that you understand where that information or the purpose of that information. So I'll just highlight it here. So how it says right here, it says for billing purposes and reporting purposes. Look at your resume and think about, do you have for, what follows behind for, whatever you're doing, that after the word for, whatever is on your resume, does it reflect that you understand the purpose or what it could be used for, right? Because, so just to continue here, um, so again, what is the purpose? So if you have a role that you are asked to fulfill responsibilities that help towards compliance. So let's say these are state compliance activities for compliance with state regs or HIPAA regs. Always be able to speak to that. I had a role that I was working in. This is what I started to say. Um, I had a role where I was working with veterans, and what myself and a group of nurses would do is that we would actually review each other's records, and we were ensuring that our records were reflecting the care that we were providing for the patient, that the diagnosis actually mapped to that the diagnosis actually mapped to conditions. And so that was a way of us ensuring that we were closing gaps. and then we were providing care for the patients. Again, I was working specifically in the veterans population, so that was more of a compliant issue for that VA contract, that we were, as nurses providing care for veterans through this third party company, we were ensuring that we were closing that gap. So therefore, being able to audit each other's records was satisfying more of a compliance requirement. Preventative care, patient education. Again, this is big on like screenings. If you have a patient who's diabetic, are they getting the foot care, immunizations for, especially in older adults and children, cancer screenings, especially for high risk individuals. Again, with diabetic patients, you also want to be concerned about their eye care. Okay, and this is great for HEDIS measures, right? Interdepartmental collaboration is very important for you to feel comfortable collaborating with coders, case managers, quality departments. If there's an opportunity for you to collaborate with other departments, do not run away from those opportunities. Collaborate with them. If there's committees that you can join those committees. Don't be afraid to join committees. Don't be afraid to step into spaces that are uncomfortable for you. For me, I challenge myself by actually going through training programs. For me, when I decided I wanted to go into CDI, I had a mentor. And even though I had my mentor, I didn't just put everything onto my mentor. I was actively involved in my own learning process. So I went and got inpatient and outpatient training through ACTIS, and I've spoken about that before in previous videos. The Association of Clinical Documentation Integrity Specialists. So they have an inpatient and outpatient training program for risk adjustment. I went through both of those, not for risk adjustment, for CDI, clinical documentation improvement. I went through both of their inpatient and outpatient programs. I studied project management at a university, went through their whole entire program. I went through a program for data analytics through a university. And again, a lot of this was because I really didn't want, and again, I wasn't trying to learn the world. I wasn't saying, hey, can you show me how to build a computer? I didn't need that. I wanted to understand data analytics. So therefore, I went into a program that specifically taught me how to do that from a professor at this university who was provided this program, who had years of experience doing that. I was working with students with different levels of expertise, working in data analytics and IT, so we can, bring everything together and learn from one another. So again, that collaboration is really important, but it does take you being very proactive about what you need to learn as well. Performance improvement. If you are doing any kind of audits on quality or any activities that have been completed in any particular time frame, sometimes, again, they have us nurses involved in so many different projects. They sometimes pull us into, can someone count how many, keep a report or a unit. There may be like a chart or a board that where all of the information is captured around supplies, the amount of either supplies or services that need to be rendered for patients. There could be equipment. I'm drawing a blank on inventory, right? There could be something around inventory. There could be like the temperatures in the med room. All of these are activities that we use to quantify, or we use to measure quality information around our performance. And they help us also to stay safe and to close gaps as well. And there, again, there are a number of transitional skills that can be added here. Again, try to keep your resume under like 2 pages. I know sometimes with nurses, we are horrible resumes. I used to be horrible with my resumes. I actually had one of my friends who has a background in HR for huge companies. She was the first person that really helped me to kind of be more focused and clear about my resume. And I would probably say for nurses, try to keep it on. I know it's tempting, We want to put everything in there, but just try to keep it 1 to 2 pages, okay? 2 pages tops. Your education, put your education down, whatever. If there are any kind of relevant coursework, so let's say if you were in a program where you also tackled, informatics, you discussed evidence-based practice, there was a special project, include that inside of your education along with your the school you attended. I don't necessarily think it's so important to include your state, where the state where you live. I probably would say kind of leave that out. That may actually help you with real estate in your resume as well, so you're not using up too much of that. Also, years graduated. I would tell you, in most cases, nurses, you can just take that out. The year graduated, in some cases, could actually hurt you. If you have any kind of license or certifications, your nursing license in state, please put them on your resume. If you have your basic life support, or you have any other kind of training, uh, like there's another one, and I'm so sorry. See, this is one of the downsides of not working too long inpatient. Some of these certifications you don't remember, but I think everyone knows the other one is the one that begins with the A. So with the basic life support and the other one, you would want to include that in your certifications. It may or may not actually have too much like usefulness if you're not in a patient facing role. But you may want to add it if you do have it there, at least to show that you have those certifications. In most cases, if you want to work HEDIS, CDI, that's like one of the first things you could actually give up, because they really don't need those certifications, like basic life support. And then for HEDIS, if you completed any kind of HEDIS training or modules, you would want to include that here. Um, and then some keywords for ATS optimization. I mentioned this earlier, but I wanted to stress it here. Using words like HEDIS, NCQA, quality improvement, quality measurement, healthcare data, data abstraction, chart review, medical record review, clinical documentation, EHR, specifying the EHR if it's Epic or if it's Cerner, for example, data validation, compliance, CMS, stars ratings, healthcare quality, clinical quality, preventative care, chronic disease management, ICD-10, CPT, HIPAA, registered nurse, RN, clinical analysis, nurse just by itself. I'll just go ahead and include that, because in many of these roles it could be an RN or LPN. Clinical analysis, and I would probably also say analyst. Okay, and performance metrics. These are just some buzzwords that helps with ATS optimization. And I can't stress this enough. A lot of this happens when you are collaborating with either a mentor or someone who can help make sense of some of the activities that you're doing as a nurse. I could actually stay here at these keywords for forever, because most of what happens with nurses is that we lack the language to put some of our activities that we're doing all the time, like those like nursing activities, and applying that nursing knowledge into something different. And we oftentimes can do that with ease if we're collaborating with people who are not nursing, because they're outside of our nursing bubble. And so therefore many of them can tell you, oh yeah, when you guys write blah blah blah, we use it to do this. Oh yeah, when you guys report blah 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 in here, that's how we did, that's how we know that this is happening or that is happening. And so when you want to have more influence around decision making, And this is another gem. I mentioned a gem prior, but this is another gem right here. Collaborate with people who are not necessarily like the patient facing folks that you collaborate with on a daily basis. Like, find out the experience, the perspective, the knowledge of the data analyst you're working with. Find out where the perception is, what the perception is of, your HIM folks, right? Because people work in health information management, oftentimes they have uh, a very they play a very intricate role in how the data that's collected from these encounters is used in different ways. So therefore, you want to find out how they're using the information and how it may impact your role. Critical strategies used in this resume. Okay, so you want to do this. Reframe clinical experience. Focus on tasks nurses do daily that mirror HEDIS work. So, for example, chart reviews, data abstraction, ensuring documentation accuracy and completeness, understanding quality measures, applying clinical guidelines, coding familiarity. I can tell you, there's about 5 codes that if a nurse could really just master the guidelines on those 5 codes, then a lot of other code sets and coding guidelines would be easier for you to understand because you can build off of it. So find 5 codes that are just really common in your practice, like for instance, like diabetes, COPD, CHF, strokes. um, I'm trying to think about a 5th one. Um, uh, AFib, that's probably the CKD would be a better one, right? So, find out if there are conditions that like you see commonly before you, and then see if you can master those code sets. And then also with those code sets, also consider like the guidelines that comes with those, even if it's just the most common ones you see, right? So familiarize yourself with coding, with coding, right? Highlight transferable skills, emphasize analytical skills, attention to detail, compliance, focus, data accuracy, understanding clinical process, disease states, and proficiency with EHRs. If you have ever been, and I have had the pleasure of being a part of EHR design, if the opportunity ever presents itself, I would say please take it. I think that's a very important skill because it checks off a lot of boxes. So, for example, if there is a rollout of an EHR system, it may seem like, why do I care about that? Being a part of the rollout of an EHR system is it's a very strong transferable skill. It shows that you are comfortable with um, process. It shows that you're comfortable with product design, or at least being a part of a product design team. And in many cases, if you are a super user, you'd be the person they call on to train on the system. So I would say definitely do not miss that opportunity. And that's a call out for nurses, nurse practitioners. If there's ever rollout for EHR system, jump at the opportunity. So use HEDIS related language. Incorporate terms like data abstraction, quality metrics, compliance, regulatory standards, clinical documentation review, performance improvement, preventative care guidelines. We use so much of that daily as nurses. Again, I think the biggest thing that where we fall short at as nurses is oftentimes we don't know what we're doing and how it's impacting healthcare because they have us front line, kind of head down working. And oftentimes we're not really thinking about the impact. You can take better control of your future as a nurse by knowing the impact that you are having in healthcare. And again, a lot of that comes from collaborating with people who are not nurses, who are telling you the impact that you're having. Quantify when possible, even if not, even if it's not direct HEDIS or CDI work. Please use numbers. How many charts did you review on a daily basis? It could be 10 charts that you review on a daily basis. It could be 5 charts you review on a daily basis. If you can talk about how many patients or on a patient panel that you manage. Because a lot of times when you're in roles where you are working on the provider panel, you are doing a review on all of those patients. So it may not seem direct to you like, okay, well, there's 200 patients on this panel. I'm working with this provider on this provider's panel. And, we have, you maybe have an interval where you have to see patients every 30 days or some kind of engagement every 30 days. Well, do the calculation, see what that looks like as far as how many chart reviews you do in a week or how many chart reviews that looks like daily, along with other activities or screenings activities, preventative screenings that you do per month. Um, And then also tailor your job description. Carefully read the specific HEDIS job, or it could be CDI job posting, and mirror their language. Look at what they're saying. Read the job description and understand how it relates to what you've been doing before, right? So if they mention specific software like chart review tools, EHRs like Epic, or if they're talking about specific measures, you always want to be able to make that connection back to what you've done in the past. Address the lack of direct experience head on in your summary or objective. Frame it positively as a motivated transition, leveraging strong foundational clinical and analytical skills. Okay, so address the lack of direct experience head on, right? You always want to say, I'm seeking this because I've had X, Y, Z experience, or I'm seeking this opportunity to use my X, Y, Z skills, right? Show initiative. You always want to show that you've completed trainings or that you have um, participated in certain projects, right? Because that shows that you have that interest. Leverage keywords. We talked about that already. Strong summary is crucial. You want to have a summary that speaks to your nursing background, yet at the same time, it show why you would be a good candidate for this new opportunity. And then having a cover letter is really important. I would say have your cover letter expand on your summary so you don't have to have this big long summary. I've seen so many resumes where people have this big old hefty summary and you're thinking, oh, well, they won't read the whole resume, so I want to give them all in the summary. Well, they won't read the summary either. So you know, don't forget that you have the cover letter as an opportunity to kind of be more expansive on what you wrote in your summary. And before sending your resumes out, right? Before complete sending, hitting that send for that application, I can tell you right now, many of applications I've applied to in the past, I'm sure there could have been some issue around proofreading. Sometimes when you're tweaking resumes or cover letters, and I'm just being honest, we sometimes tweak things, especially if we feel like we're under pressure or if we're in a timed application, we may feel like we're under pressure. Try as best as possible to proofread it. Take care of any typos, because this will definitely take you out if you say that you are a detail oriented person. Format using very simple, clean formats. I have seen resumes where people have all of these different panels going because let's say they use a layout where there was a panel for your skills or hobbies, and there was another like a centralized panel where you can write your work history. Then there's like a top panel where you can use this great, beautiful, colorful graphic for your name. ATS systems are reading things from left to right. It will confuse it that you are sending them information and there's columns that they need to read from left to right. So you can imagine that if they're attempting to read your information from left to right, how that may actually translate when you have all of these different columns. So just keep it simple. Just use a regular Word document. That's how I feel. Again, those beautiful, flowery, colorful resumes are pretty when you are printing it out and handing it to somebody. And in some cases, you may do that. You may actually interview for a position and then you are sent out to do maybe the screening is over the phone. Maybe you may do another layer of screening or an interview with someone else and is virtual, but then they may have you come in person for other parts of the interview. If that's the case, bring the beautiful, flowery, pretty resume, print it out, and hand it to someone. That's what those resumes are for. They're not made for these ATS systems that are reading the resume. So you want to also make sure that your layout is not confusing the ATS system. And then have someone who works in healthcare, works in healthcare quality, or works in HR give you feedback, because at the end of the day, that's really what you want. You want to be able to get feedback from somebody who's working in the industry and they know exactly what you should be able to do on day one in that new role based off of what you've been doing in the past, and then also other skills that you need to master if you're going to be successful moving forward. It's also important for growth that, this is a call out to managers, higher managers. This is a call out to nurses who want to transition. And this is also to help nurses, most importantly, with issues around imposter syndrome. There is no growth if you come into a role where you have all the skills coming in. There's no opportunity for growth. And that may sound so scary, but I know people, in fact, someone who's very dear to me, who is an expert in his field. He is having a hard time getting in the door when he transitions from jobs to jobs. If he ever looks for another role, he's always having, like, he's hitting like a wall. This is again a nurse who is highly credentialed, knows his stuff in HIM, and it's because I really think that it's an issue around the fact that there's not really a lot of opportunity for him to grow with the organization. And organizations want to know that you're able to, and willing to take baby steps with them. It's very hard for you to have a person that takes baby steps when a person has so much information, because they come in kind of being able to hit the ground running. So those individuals probably would do better, in my personal opinion, in executive roles where there is not there's more of an expectation for you to oversee and apply the information or knowledge that you have, rather than working out problems. Because if you're working out problems with other individuals who are quote unquote growing with the company, there's a certain level of ignorance that everyone shares. But if you come in with too much, right, then it may not necessarily look like a great growth opportunity for the company, and they may see you as almost a flight risk, so to speak, because it's like, well, you're coming in with so much information and so many skills, you can do this anywhere. How long are you going to really stay here? I don't really think that companies should be so focused on that. I think companies should be focused on, showing love and appreciation to their staff, so their staff doesn't feel that they have to leave. But in many cases, I find that employers will get preoccupied with that concern, like, oh, I wonder if this person is going to leave for this reason or that reason, because they have some different skills, or maybe they have a new certification under their belt, and that fear comes about, like, are you planning to leave once you get the certification? I remember I was asked that once when I finished my project management training. My employer immediately said, because they paid for it, but they immediately said to me, are you planning to do something else with this, like, at another company, another organization? And so kind of reassuring them that I was looking to, use these skills directly. And at the time, interestingly enough, I was in the middle of a project, an EHR project. We were transitioning to a new EHR system, and I was working with the project management team and and I was actually, going to be a super user on this system. So therefore, I was directly involved in the process. I was in a leadership role. So my role was really to help ensure that I understood the ins and outs of this new EHR system, because I was going to be training my team once the system went live. So again, not to go on a tangent, I just think it's really important for you to understand, how to represent yourself on a resume. Again, I really encourage you to look at our Nurse Naomi app. The app is really useful to help nurses to understand how to brand themselves. I will be including the ad for the app at the closure of this video, but please send me a message. You can leave a comment under the video. You could also email me. The contact information will be a part of the end of this video. Please feel comfortable just telling me exactly what it is your concerns are, what you're looking for. If you do want help with your resume, set up a consultation so we can look at it. But I definitely want you to take some of these tips and ideas that I'm sharing here and really consider how you want to brand yourself for the next stage of your career. Thank you.
If you are interested in learning how to advance your nursing career by leveraging your nursing knowledge in a non-traditional role, enroll in our transition coaching program and download a free copy of our My Transition Journal today.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com or visit our websites www.advancednurses.info or www.acd4n.com.